remember those perceptions or those misperceptions of who can be infected or this is a white gay man's disease. That wasn't true back then. It's still not true now. Everybody is vulnerable to contracting HIV, based on how the disease is transmitted, and who you're having sex with, or maybe engaging in behaviors that put you at risk for contracting. So it can be certain drug use. And we even get into the discussions of, like, if you're diabetic, you shouldn't even be sharing your needles with somebody else that might not have access to needles, because how we have this insulin and drug problem with getting prescriptions. So that's a real thing in real time when you're talking about HIV. So the goal of one of the goals of the HIV fight is for those that are living with HIV to have an undetectable viral load. And that's the U equals U campaign, where if you're undetectable, you cannot transmit the virus. And that's one of the progressions in this HIV, to help um, reduce the transmission of HIV. And hopefully we can get lower and lower numbers. But I also tell people, for instance, gonorrhea and chlamydia are curable. So even if HIV becomes curable, does that mean those cases won't, we still don't have cases? It comes down to what are the factors that are leading to these cases. Because I just quoted you some numbers, and chlamydia is way surpassed HIV in numbers. And to quickly touch upon, when you asked about the male to female transmission versus female to male transmission, Gina, talked about some things. And one of those things, and I'm not a medical doctor, so please, because what happens sometimes when we give information, people latch on to it and they'll isolate themselves because they don't think it applies to them. But just keep in mind that our anatomies are different. So our vaginal area, we have the vagina versus the opening of the vagina versus the male's urethra is a small opening. That's one little thing. That's not the whole thing about male to female or female to male transmission. But, like, for instance, you know, people who are living with HIV, life hasn't stopped for them. I mean, they're in love, right, Gina? They're in relationships. They're having sex and all of that good stuff. All we're talking to them as providers, is about making sure to protect yourself as best as possible. Um, Even if your partner is undetectable or you're not sure of your partner's viral load. Because in that case versus women, the situation of female transmitting it to a male or a female partner, in particular and specifically a male partner, I tell my men, you be careful, and I tell my women that too, you be careful what you licking. Because, like Gina mentioned, HIV is transmitted through vaginal fluids.
Right.
So even if it's not contracted through the penis, what is going through your mouth? you know and that's important to understand that too, because people tend to think HIV, you can't contract HIV or any other STI or STD through oral sex, because they don't see it as sex. If you're not penetrating the holes, the vaginal or the anus, you're not having sex. And that's a whole bunch of other topics there. But the
Well, people
important thing
say that
about
ain't sex.
HIV, oh yeah, I make them repeat it. If you say oral and then you say the word sex and then you say it's not oral sex, I'm like, I know I just heard you say sex after you say oral. But
Well, Bill Clinton said it wasn't sex,
but
so hey.
yeah, but then it becomes like, okay, even if you don't see it as sex, it's still a way that you can
Right,
contract it.
right.
We don't want to get caught up into what you believe versus what I'm saying. But what I want you to understand, we want you to understand the facts. Because the fact is, there's the body fluids in which HIV is transmitted in. The behavior is how the body fluids come out, you know.
Right.
And if you think, and when we say vaginal fluids, you thinking it's, if it looks pretty and it's clear, HIV is not there. You think it's supposed to be looking smelly, foul, and chunky. The term is vaginal fluids, whatever comes out of the vagina. You get what I'm saying?
Mhm.
And so when you're trying to start naming stuff to make yourselves feel safe, like, oh, she was clean because it was clear. I know what a yeast infection look like. That ain't got nothing to do
Still a
with
fluid. It's still a fluid. A fluid is
yeah.
still a fluid. Right.
Fluid is a fluid, whether you
Yes.
however you want to define it. What you got to understand, and I think people tend to get it when we talk about the body fluids in which HIV is transmitted in. So, for instance, um, you know, the four body fluids we talk about is male semen, and you won't believe how I have to say, I don't know about you, Gina, is semen is what comes out of the penis, and the sperm is inside the semen. So if a man gets a vasectomy, he still has semen coming out of his penis, but
Say
he
it again,
doesn't. His
please.
soldiers, his soldiers ain't marching anymore, but his semen is still there. So that's the body fluid from the man. Well, the male semen, if he's positive, he can transmit it that way. Female
Even
vaginal fluid.
even pre-semen.
What?
Even pre-semen. Let them know about
Yeah,
that
it's
too.
semen.
Semen is
It's
semen.
semen.
We need to understand
Semen.
that.
Yeah, the man can say I nutted a little bit. I didn't come
Uh-huh.
hard. However you
It
want to
don't
say it,
matter.
that penis gave off semen. That's the key. Semen came out of that penis. So vaginal fluids is the second one. Third one is blood, and the fourth one is breast milk. And
Okay.
all of those body fluids have to come from somebody who's living with HIV.
And
Hmm.
And
rectal
we,
fluids. Don't forget the
Don't
rectal.
forget anal juice.
Yeah, rectal fluids.
Yeah.
Rectal
well,
fluids.
well, listen,
It's
listen.
there.
Your four body fluids. So if this is how I try to, at least how I try to do it. You have four body fluids, then you have the behaviors. So if you have an anal sex, get out of here. That's my son, y'all. Get out of here. Uh, so he said, "You in my room," and I am in his room. Close the door. Okay. So you have the body fluids, and then you have the behaviors. So if you have an anal sex, then you're gonna have the fluids that come out of the rectum. Is it blood? Blood comes out of the rectum, not anal. I'm sorry, not vaginal fluids. It's the blood,
It's,
But no, it's
okay.
not just
right?
blood.
It's not,
No.
it's not just blood.
Right. No, I'm
Right.
about to say, I see something.
It's a lubricant. It's a lubricant that people who have anal sex start to produce this lubricant that they don't have to use lube all the time. So it's just like with a woman. All women don't get wet, right?
Mm-hmm.
But
I
sometimes
don't
it's
know
in
that.
the middle of sex that she'll start to get wet.
Right.
So
So
Waterfall.
it's
the
the
key,
same
the
thing
key is
with
right. So the key
anal fluid.
is to know the body fluids, how it's transmitted,
Yes,
so you can understand if you come in contact, because HIV is not only transmitted through sex.
right.
Right.
Some of your STDs or your other diseases are not always transmitted through sex.
Right.
So when a person is having, say, if a person is having what we may call oral sex because they sucking on titties, they don't see that as sex. But if a person has HIV, is living with HIV and has a discharge, maybe the breast milk or the blood from cracked nipples can potentially put somebody at risk for contract. So if we're gonna fight with, okay, that's not sex. This is that was just a little foreplay. I was just trying to do this. You still have to understand how it's transmitted. That's key. That's very key to knowing if you need to get tested. Should you get, of course, you should get tested beforehand. But if you're engaging in a behavior that puts you at risk, so it can be a sexual behavior, it can be a drug behavior. If a worker gets pricked by needles,
Right.
they get tested. Things like that because of the fluid, the body fluids HIV is transmitted in. So, I tell people if when folks, I don't, you got to use examples that you got to use. But, when police stop folks and they search them, they'll ask you, do you have any needles in your pocket?
Right.
Right? Or do you have anything that'll stick me?
Right.
And that's for a reason.
Right.
And I'll say to my audience or whatever, when you go to the doctor, like for instance, ladies, or even gentlemen, when a doctor takes care of you, are they putting on gloves or going in raw?
Can I interject?
Yeah.
What about talking about the sores? Because people have sores in their mouths and they think that is okay as well. If you have sores in your mouth, whether you're brushing your teeth, you're scratching your mouth, and you incidentally scratch your mouth, that's a sore. That's an open wound. So they need to understand all of these things, that how they can actually transmit that virus, and that's one way as well. People think, okay, well, she sucked me off. Well, yeah, she sucked you off, but guess what? She had AIDS or HIV or whatever the case was at that particular time, and she had sores in her mouth, but she sucked you off.
Well, it would have to be bleeding.
Right.
It would have to be bleeding sores.
Right.
It couldn't just be sores in our mouth.
Right, but most of the sores that's in your mouth are have some type of bloodstream coming out of it.
Yes.
So we got to think about all of those things. Yes,
but
it does have to be.
We have to think about is,
and if you're putting it in your mouth, you can easily get it to start bleeding again. Right or wrong?
Yes.
Okay.
Yes. And we also have to
start sores can be another source
about HIV, right?
I'm sorry.
If we talk about HIV as a behavioral thing, HIV is a health and a social disease.
Right. It's not
a behavioral disease. My behavior didn't give me HIV. I contracted HIV because I had sex with somebody who had HIV. You know what I'm saying? So if we can get away from the language of behavior and risk. I used to do testing at Walgreens on Elysian Fields and St. Claude.
You do have to look at it as a behavioral, regardless to if you got it transmitted through another person. Your behavior was through sex. And that's
everybody don't contract HIV through behavior. There are babies born living with HIV.
Yes.
So it's a whole lot.
But when we talk about
what we're trying to do is get people comfortable with HIV and not stigmatize it more. And when
so we can use that word. We want to get them comfortable without stigmatizing it more, because when we on the clinical side, is a behavior for us.
Right, but I'm asking y'all, even on the clinical side, because you're stigmatizing people when you talk about their behavior instead of just their life.
And I get it. I get it. I get what you're saying.
And
I understand fully.
They have a program called.
I wouldn't probably say that to a person that I'm talking to, but clinically, yes, discussing it with a clinical individual, yes, I would say behavioral. But if I'm talking to an individual who has it, I'm gonna talk to them just as normal as I'm talking to anybody else, because I don't want to stigmatize anybody. But at the end of the day, clinical terms, we can go through this all day. It's still a behavior, regardless of how you look at it. It's still a behavior, but we don't want to utilize that term on here because we're talking to general people.
Yes.
So I get you.
Yes. Thank you. Vive has a program called From Risk to Reasons. And that came about because I was doing testing in Walgreens. And when Black women would walk in and I would say, hey, sister, how you doing? My name is Jean. I'm doing HIV testing. It's free. And then I would start talking about risky behavior. And they would look at me like I had two heads.
Right.
And they would say, I don't have risky behavior. I have old man.
It's not a norm.
And I said, if they don't think that is risky, then I can't call it risky. So how do I reach them? By letting them tell me what they do and how they do it. And then we have a conversation about that. So Vive they have a whole program called From Risk to Reasons, because it's about the reasons that you're going to get tested. It's the reasons that you need to use a
Mm.
condom or take PrEP or know more about HIV. There are reasons behind this, not because you're at risk, but because you have a reason to take care of yourself. You have a reason to want to be healthy. You know, even though I'm living with HIV, I take my medicine every day. As a matter of fact, my phone gonna go off in a minute because I still use a timer, y'all. My phone gonna go off so I can take my one little pill before I go to sleep tonight. But it's all about how we talk about HIV. HIV has been a thing that's been the scariest thing in this community for years because we never talked about it in a way that brought people in. We talk about it in a way that pushed people out. You know, when we
Right.
talk about I understand that clinical people gonna say certain things. I understand that CDC
Yeah.
still says MSM. And the community hates that because they're
Right.
not MSM. It's not who they're having sex with. They're gay, bisexual, same gender loving men. They're human. But we have all of this language that truly does not help
The individual.
people tested or get people in care. We have language that push people away. And I'm
Yeah,
gonna
and
shut.
I totally agree. And we should be using individualized languages when we're talking to people. And like I said, clinical terms are clinical terms, and we learn to use them
Where you been
clinically
at?
when we're supposed to. But when we're talking to
Why?
individuals, yes, I do agree with you.
Yeah, and I think that's also the thing that's
People first
ongoing in the
language.
HIV field.
You got a
The
box of
HIV
Popeyes?
field, yeah, HIV field is to meet the
You got a
people
whole
where
box
they're
of
at
them?
and they're comfortable. Because
Right.
certain people are okay with certain words, and
Why
then
are you
certain
using
people
that?
are not okay with certain words.
Right.
Um, like I'm not okay with using cisgender women, so that's a thing. So if if there's some terms I use that whoever I'm talking to are not comfortable with, I just ask, what are you comfortable with me saying? Because sometimes when you get into the groove of things or you're used to certain things, because words and topics and categories have changed
Right.
um over time in this field. I mean, so just to be open, and I think that helps relaxes people when you're open to sit down and talk to them like they prefer to be talked to or talk with, instead of talking down to,
People
because
first
I'm not gonna
language.
sit up, yeah, I'm
Yeah,
not gonna sit and call my people who are using, drug addicts and crackheads and things like that. That's not how I'm
No,
gonna talk to them. So,
not at all.
so
I mean,
you
my
know,
mom used to be on drugs, so I mean, why would I want somebody to disrespect her? I say used to be. She's no longer here, but I mean, she didn't die because of that. But I'm just saying. So why would I want somebody to offend her? You know what I'm saying? I don't want to offend anybody. So people first language. Yeah, I do believe in
yeah,
asking a
no, but
person
yeah,
what you want me to
right.
call
So
you.
what was happening, meaning, the conversation, the things that Gina is bringing up, is an ongoing conversation in HIV field. So it's to the point where, as providers, we sit down, and even individuals that are living with HIV will sit down and say, okay, what are we comfortable with talking about, or how we should address this, and this and that. Um, and that's an honest discussion. But also the other part is to make sure that whoever needs the services available get, respectful services and access to services. Um, if to get basically to get, used to the condoms, to the Narcan, to the testing services. One of the issues that's also being talked about in the HIV field is, um, organizations need to be careful who they put at their front desk, because
Hello.
before they see case managers, they see the receptionists. And
Mm-hmm.
if those receptionists or those um intakers, that staff is not welcoming, I'm not going there. I'm not going to that, and I might miss my treatment because I didn't had enough. So that's a big discussion too in the HIV fight. Just knowing how to treat people like human beings, however they
Absolutely.
identify it or whatever terminology we are comfortable with. Um, let's see how we can make it work. So we can get the services that people need in a respectful and dignified manner.
I tell women all the time when I talk to them about HIV, because it's like I said, it's not about the risk, but I always ask them, I say, do you have children? And they'll say, yes. And I'll say, have you ever gotten tested for HIV? Oh, no, I've been in a relationship for 15 years. And I say, the same way you got your baby, that's how I got HIV. And then stop them.
Mm-hmm.
And they make it real to them.
Mm-hmm.
Because they don't think about that.
Mm-hmm.
A lot of people still think that the only way a woman can contract HIV is if she's promiscuous.
Yeah. Well,
And there's no such thing as HIV because you're promiscuous. You either get it or you don't. You can have sex with 100 men. If none of those men have HIV, you're not going to get it.
Not gonna get it
You can
right.
have sex with one man. And if he has HIV, then you're going to get it. You might get it.
Right.
So it's not about the number of people. It's about the person that you have sex with. And we don't talk, especially in our community, the Black community. How many times have we've and Tamasha, you know this. We've had conversations with women, and you say, well, do you ask your man, do he have sex with men? And the woman will get mad with you because you asked her, did she ever ask her man that? But we know that the way the jailhouse doors open and close, some people are gay for the state. And then they come home and then they back to being heterosexual. But we don't have those conversations. So HIV is in our community. We're doing a good job with bringing it down because of something you said in the beginning, Mr. King, when you said about zero, about undetectable, people having a zero viral load. If our community viral load is low, then the chance of HIV being just spread willy-nilly in our community goes down. It's only when community viral loads are high that you see a lot of HIV there.
Now, what about the new med, the PrEP that's out? Because I've heard a lot of people say, "Oh, my viral load is undetected, so I'm not positive anymore." So, because I've heard people say that I'm not positive
yeah,
anymore.
I've heard it too.
Mm-hmm.
I've been
No,
undetectable
yeah,
since
I've heard that.
2003. And
And Gina, what, you still got it? You still
and I
got
still
it,
have
Gina?
it. It ain't going nowhere. And I still go to the doctor. I still do everything I'm supposed to do because I want to continue to be undetectable. I'm trying to make sure that my organs last a little longer. A little longer, trying to prolong my little life, that kind of thing. But no, undetectable having a undetectable viral load does not mean that you no longer have HIV. You still have it.
Yes.
So
So, for
when y'all,
instance, when we test individuals, we test for HIV, syphilis, and Hep C, and we have to ask them, have they ever been tested for those three before? And they can say yes or no. If they say yes, then we'll ask them, did they have a positive result? So if you got tested for syphilis and I'm sorry, if you ever had syphilis before, the test we take is going to show that it's going to come back positive, even if it was cured, because syphilis antibodies are in your system.
Right.
When you have syphilis, you can't give blood because those antibodies are in your system. There are several diseases or illnesses or medical conditions, I'm put it that way, medical conditions that you can't donate blood if you have had, including diabetes, including hypertension, including HIV, including syphilis. Um, so if you say, okay, I've had syphilis before, I've had HIV, I've had Hep C, we cannot perform those tests on you. Hep C has a cure to it with the treatment they have now. That's an advance in science. But what we'll do is refer you to a provider that does the blood work to see if you have syphilis again or not.
Till
And
you
if
can't
Hep
get it
C,
again?
if you have been, Yeah, you can catch it again.
Okay. Okay.
Yeah.
Damn.
No, I'm not talking about HIV. I'm talking about syphilis and
Yeah, syphilis.
Hep
Yeah.
C. Um, Now, and Gina backed me up on this as well. Like when you're living with HIV, we've had situations where people when may say, okay, well, both of us are HIV positive, we don't need to use condoms. That's a no-no because if you may reinfect your partner with your strain of the virus, which may make them resistant to their medication.
Damn.
So just because the both of you've had are living with HIV doesn't mean free sex. So you have to be careful with that. Um, you always talk to your doctors about that. We tell clients always talk to your doctor about having non-protected sex and what that could mean as far as your adherence to your medication. Because we don't want you um, not being able to or your medication not being effective for you anymore because then that's gonna mess up your viral load.
Right. Wow.
You know, because, because it's not your medication is the medication is designed to suppress your viral load and to help, like Gene said, them organs last a little longer and life. Uh, so it also HIV is no longer considered a death sentence. It's classified as a chronic illness because of
Mhm.
the progression in medications and things like that. So, for instance, like you're asking, you get cured from chlamydia and gonorrhea and keep getting it because you're continuing. Trust me, we didn't have those. We didn't have those, and we didn't had the clients, and some of them be like, oh, thank God it's just gonorrhea. Thank God it's just chlamydia because of the stigma of HIV. As long as I ain't got that gangster, I'm cool. I could take a pill and get rid of this chlamydia, and being doing the educational pieces, like you really have to give them how these medical conditions or STDs, STIs are transmitted because you can't get gonorrhea in the throat, in the mouth, in the anus. So a pee test
Damn.
might not detect it, but a swab will detect it because it's in the anus. So you have to really know how those viruses or diseases or those bacterial infections work. And when you were mentioning about the sores in the mouth, that can be indicative of it is oral herpes. And I tell people all the time, oral herpes is not always transmitted because somebody sucked the penis. If
Mhm.
your 85-year-old grandmother kissed you with a cold sore on her lips, she is now possibly transmitting the virus to you because herpes works skin to skin contact.
Right.
So if the skin is touching, that's where transmission happens. So you really have to understand how these diseases are transmitted to tell people you might have this or this is how this working versus what they hear on the street. And I tell people if I open up this bottle of water right now and drink out of it, and I give it to you and say you drink out of it, you gonna tell me, hell no, I'm not drinking behind you. So you need to be careful about who you kiss.
Yeah. But not just that. People need to understand that they need to stop people from kissing their kids as well.
Mm-hmm.
Exactly.
And the adults need to
Exactly.
understand, don't get offended when a parent tell you don't kiss my child.
Mm-hmm.
Right. Exactly. Exactly. Because
Y'all
I,
want
I
y'all
we
want to
got I
hear
got
the
a lot of old
weirdest?
schoolers.
You want to hear the weirdest outbreak of herpes that I ever heard of in my life? In New York, the rabbi circumcises the baby, and after
Oh
he
damn.
Mhm.
circumcises the baby, he sucks the blood out of the baby's little member. Um,
No.
and all of these babies got herpes. Yeah, yeah. And it
That's
was
how
a
they go.
Yeah,
it
be
was a
careful.
big scandal in New York. It had to be about 5 years ago. Look it up. But
But
all of these
that's how they
babies,
do that. That's how they do that. That's how they do that.
Yeah.
I don't
The
even want to know if
robot,
that's how they do
but the
that.
I don't want to know
skin.
that either because I don't need
No,
nobody sitting on my couch
I
watching
no.
that
do.
work.
I gotta Google that one.
Yeah.
Yep.
No,
Hell,
Let me give you one. Yeah, let me give you one better.
no. That can't be a
There was
thing.
a
Sorry, no. That can't be a
yeah,
thing.
there was a
No.
yeah,
they literally
but check.
that's molestation to me. I'm sorry.
Uh,
Gotta be some form of
That is
molestation.
molestation.
Like
religion gone wrong on that one. I'm
what's
sorry. That's
going
That
They
is
gonna
on?
say
uh,
they gonna say that's
that's
cultural. They gonna
that's
say
Yes.
that's
molestation.
cultural.
Sorry.
religion
Yes.
gone wrong.
They
I'm
gonna say
sorry.
it's
That's
cultural.
There's no other words for it. It's
I
molestation.
know, but check this out. They just had a video circulating of some of the healthcare nurses. I think it was Georgia saying about the uptick in oral herpes because of the hookahs.
oh.
So
I'm so
smoke
happy
that
I don't
hookah
smoke
and
that shit.
share it.
Yeah, puff puff give. You ain't puffing shit over here. I don't even
Yeah,
want
so
this.
that's why people tend to have their. I don't smoke
The
it, so
tips.
I guess
I
people
don't
have their
either.
little stems, but then you have the people that share. So you have to be careful
Let
about
me tell you
sharing what
something.
you put your mouth on.
I don't even share
Um,
my drinks with my children, nor my grandbabies. I've
yeah.
been like that since Hector was a pup,
I,
okay? I don't want to drink after you, and I don't want you drinking after me. First of all, I don't know what you putting in there. Y'all be backwashing and all that in people bottles. I don't want none of that. So
well,
if
we
I
was
don't do that
always
after my kids, I'm damn sure not gonna be in the streets puffing off of nothing nobody else than put in their goddamn mouth. And
So
men and women don't even know who they sleeping with because their partner's sleeping with somebody else and they thinking they're being faithful and they're not. Their partner's sleeping with somebody else, and then on top of that, the person that the partner's sleeping with, that whole sleeping with somebody else too.
Black men don't cheat, so don't start that. Black men don't cheat.
Go ahead, baby, go ahead. I ain't even
but
say,
but but
I ain't even say race. I just said race in
Okay, well,
general.
but
good then.
but
Black
it
men
happens
don't cheat.
though. Because I know a couple
but
that
but
happened to where the person was
right. But
cheating
as a
and the wife
provider,
called
you got to
pure
be
feed.
careful.
Yeah.
Yeah, but you got to be careful how you present what you're trying to get across to the people you serve, because
Right.
if you're trying to tell every woman, especially black woman, that they meant cheating, they're gonna shut down.
Yeah.
Hmm.
No,
So
and I
if
get it. I'm
you
a counselor,
bring
so I
in,
get it.
if you bring and fellas, if you talking about, man, men really believe oral sex ain't sex, or if they don't believe sucking titties is sex, and I get that. But if you start saying, okay, man, do you know HIV can be transmitted if you trying to suck on a woman's breast and that breast milk, you know, that breast milk coming out and she's living with HIV. You trying to tell your folks this is reasons why you get tested, versus saying, yo, you never know what your man doing. You know, here's take home test. Here's the number to call. Here's where you can get tested. Here's condoms. Because it's hard to tell a woman that's in a domestic violence situation to tell her partner to use condoms.
Hmm.
She gonna get her head knocked between the
Not
washer
the
and
hell.
dryer.
Ooh,
Yes.
mm, might be knocked
So
off.
you have to be creative to say, okay, when you need to get your medication, you ask your neighbor to pick it up. If that's you're just giving them options. So before we get like, girl, this, I just, before we do that transactional or that giving them our experience, the goal is to get them to know their status and know how HIV is and isn't presented. I mean, transmitted, and the other STDs and STIs. Because like when we talk about how herpes is transmitted, people be like, "What?" Because you won't believe my older school, my 50 and 60 and above, tell me how their grandmother told them fever blisters was because of the sun is out,
Baby,
and
we
that's
just
how
had
you
this
get fever
conversation
blisters.
about people in the 1950s and 60s, how they see everything in black and white. They only
Right,
know what they were told,
Yeah.
and that's how they
right.
live their life.
So that's an opportunity for a conversation. A conversation, and when people are being very vulnerable to you about their lives, whether they're dealing with addictions, homelessness,
Hmm.
infidelity, or just not knowing. It ain't always got to be the negative stuff. because I tell my church goers, you can be saved and sanctified and still be HIV positive because you didn't get tested.
Mm-hmm.
And they have nothing to
You
do
know?
with God.
Thank
HIV
you.
has nothing to do with God,
Thank you.
because babies are born living with HIV. And I
Thank
think
you.
a lot of times people think that there's some kind of shield or some kind of protection. The only thing that separates me from you is I have a virus. That's the only thing. I have a son, you have a son. I'm educated, you're educated. I'm a black woman, you're a black woman. I live in New Orleans, you live in New Orleans. I drive a car, the only thing that separates us is my virus. That's it.
Right.
You know, but that virus is not the most important thing about me. You
Hell
know,
no.
I tell my story not to entertain, but to educate, because I really want black women to know that in 1994, when I was diagnosed, the only people you heard about were gay men, right? So when I got my diagnosis, I really thought I was the first woman in the world with HIV. Oh, and when I went to C100, which was the HIV outpatient clinic at Charity Hospital, and I saw all these black women, I asked them, I said, where were y'all? And they looked at me like I was crazy. And they were like, what? I said, where were y'all? Where were y'all when I needed to know y'all existed?
Yeah, the education of it.
And I said, if I ever find my voice, I'll make sure that other women know that this thing is real.
Let's go.
It impacts us.
Let's go.
You know,
let me tell you something about Gina. Let me tell you something about Gina. Gina was real shy when I met her. Like, I'm not fit to say that. But not Gina telling you risky behaviors is if you having sex on the chandelier. That's risky.
She found her voice.
Yeah.
She found her voice. Let's go.
So and I think also the things Gina talks about in comparisons, like she said, you know, we're the same. What makes us different is this, that, whatever. Because, you know, she tells you about her time of addiction and, you know, those parts of her life. However, you have another person sitting next to you, like I was in a relationship. I wasn't dealing with it. You know, just to see the many faces, because the stigma and the stereotype is people who are black folks who are HIV positives because of drugs and they fast. And that's not the case. I could get somebody online. Her first time having sex, she got infected. First time.
And it has nothing to do with being fast, because that was her first time.
So we need to understand that, you know, that's the things we need to understand as a black community, and not put our guards down and be able to, I know we're talking about a lot of stuff, to be able to use our voice and to talk. Like in the beginning, when you're meeting somebody, hey, I'm Samasha, I got a son. I love to do this. I love to do that. When I become intimate with a man, he has to be tested. He has to wear condoms. You say that in the beginning. In the beginning. In the beginning. So, you know, if that doesn't work or that does work or whatever, it's out there and it's something we need to stick to. And I think for my men, for my heterosexual um couples, you know, when you dating in that manner, it's like you need to stand up and say, I love to see a woman that likes to get tested. Versus, man, I ain't got that. You know, what your results say. If your results good, I'm good. We got to get beyond it. We got to get beyond it. But I mean, the things I'm saying can apply to any type of couple. Same sex couples, same gender loving couples, heterosexual couple, whatever. It's just the conversations to have about getting tested. Um, and I think for me, I believe it's very important that we do that up front. You know, whereas if somebody tell you, man, you tripping, don't worry about it. I got tested 6 months ago. No, you need to get tested again, though.
That was 6 months ago.
6 months ago. And be adamant about it.
Do y'all think it's more prevalent in the older generation, like 60 and above or 55 and above, rather than the younger generation?
What you
The
mean?
stats.
It's only that we're aging. We contracted HIV in our 20s. Now we're in
Well,
our 50s.
yeah, I mean, when you're like new tested, I don't mean
So
like.
so now so your stats for HIV shows that most of your cases are in the ages of 19 to 25, and a big bulk of them are 19 to 44. Um, and you're seeing the increase in the 60 plus category because of Viagra. Viagra and all of the other. That's the truth.
Yeah.
That's the truth. That's the
Girl,
God honest truth.
Well, I
The
believe
baby.
Viagra
Viagra.
got
it.
them popping.
And the the fact that our older our well seasoned veterans are still got their thing going. Now,
Mhm.
unfortunately, with the gonorrhea, and that's kind of across the board with all categories
Seasoned
of
veterans.
well, in terms of the age group, it tends to be that 19 to 44 where you see a bulk of a lot of your cases right there in that age group. But you will see a lot of it in your 50, 60, 60 plus age category. They're not exempt. So, unfortunately, you will see gonorrhea and chlamydia cases in less than 10-year-olds. So that's indicative of there's possible sex trafficking, molestation, or you just have these young girls out here.
Mhm.
And that's unfortunate. So there's a lot of factors that you have to look at when and think about when you're in this HIV fight and working with clients or just consumers or people that's trying to prevent from getting HIV, or our our genas that's living life with HIV. Um, Medications. Sometimes you're on medication as soon as you get your diagnosis, then sometimes the doctor may wait. It depends. It all depends on how your health is going. So with the prep, you have to be HIV negative. And one of the fights in regards to prep is Black women were not targeted or advertised when prep first came out. So we've done a lot of fighting for Black women to be included in research and advertisement to use to be targeted to use prep, and a lot of the case management and services can be on a sliding scale, can be no cost or low cost depending on your provider and your case manager.
And
Like
also
you get
reach out
condoms for free.
to the agent, to
Yeah.
the company that makes the medication. A lot of them
Yeah,
have
if
the
you can
patient
afford
assistance
it.
programs, and they can
Yeah.
help with some of that stuff. Even with HIV meds, they can help
Right.
you be able to afford them.
Right. So Truvada, let's say Truvada is a med. Truvada is the company, right, that makes the med. That's not government. So Donald Trump can't control that. And it might sound like I'm being funny, but when the
He
government
can.
gives money for medication, they try to control it.
Mhm.
So you can write directly to the manufacturer and ask them for your medication. And then that's not just HIV. Like people are dealing with high blood pressure, insulin, diabetes, any cancer medications. You can actually ask the actual manufacturer to help you pay for it if you can't pay for it. I mean, to pay for it or give it to you if you can't afford it.
Yeah.
So if
And
someone
Gilead
wanted,
makes Truvada, Descovy, and they have a new injectable coming out that's going to be a 6-month prep.
Yeah. I'm sorry.
And
Yeah, I'm
Vive
sick. Yeah.
makes,
So,
yeah, Vive has one injectable prep, Apertude, that's already on the market.
yeah.
all right, and if
And when
someone
you,
wanted to get
yeah.
tested or get free condoms, or they know they positive and looking for treatment, where would they go?
I would send them, if it's
Well, they can.
somebody who, I would send them to Tamasha to get tested, but I would send them to Crescent Care because Crescent Care has a rapid start clinic. So when you come in, you can immediately get in care. You don't have to wait for your numbers to start dropping or anything. you know.
Yeah. That was something that was advocated for in the HIV field because sometimes you couldn't get an appointment till 6 months,
Yep.
6 months down the line after you received the diagnosis.
Yep.
So, and that was to help people to get in and stay into care versus being lost to care. You get them in and you say, come back in 6 months, you might not see them.
Mhm.
And that's a challenge in as far as care and treatment, getting people to stay into care and treatment. So they also incentivize it. So, for us, when we do testing, we give you a gift card because we know what draws you to come
Yeah.
get tested. And it works. We ain't got time to argue. Oh, they gonna sell that gift card. I don't care. They know their status, and you up here running your mouth, and you don't know yours.
Yeah.
Yeah.
So,
Yeah,
so
Y'all,
that
what kind of gift cards y'all giving away?
Walmart, Walmart, Walmart.
Y'all hear that, huh, my people? Y'all hear that, huh? Go
I'm
get
gonna get
Yeah.
tested.
tested.
yeah,
Go
see
get
So
that's
my
tested.
name on there, my
I need
name
a
on
gift
there
card.
choose the name of the HIV prevention mobsters. We on Instagram and Facebook. And if you look us up on Instagram and Facebook, you look us up just like that. There's no other group that we know, at least in New Orleans, that is called HIV prevention mobsters.
But hey, what's the meaning behind the name? What's the meaning behind the
Oh,
name?
the quick story behind that,
Yes.
back in the day with MySpace, right? If you remember MySpace, they had the mobsters thing, right? So they still kind of call it that, but they call HIV the gangster.
Mm-hmm.
So the staff I had back then, I came up with an idea. I said, I got a crazy idea. If y'all down with it, I think we can pull this off. And because we like controversial conversations, because that makes you talk about HIV, right? So if we catch your eye, then we can get in the conversation. And back then, we were big on having billboards up. So anyway, I say I got this idea. Let's call ourselves HIV prevention mobsters. And I thought they was gonna say, Tamasha, you crazy. They was like, we all in, we all in. And I say, okay, now here's the crazy part. Everybody's gonna have a mobster type name. Like the boss, his name is the condom godfather, right? And then we had the chlamydia crusher, and we had the gonorrhea something. I'm gonna have to send you a picture of the billboard. It had our names on it, all of that. So I was the HIV enforcer, and everybody told me my name was boring, but it don't matter.
It didn't go with the program.
no, not
Yeah,
the
so we
influence.
did. So from there, everybody agreed, and I was like, okay, when you work in this field, sometimes you get associated with it. So everybody think you got HIV, somebody think you got chlamydia. It don't matter to us. We trying to get the word out. So
Right.
we had that name since since we've had that username like 20 years now. So we
Wow.
put it up on billboards. It actually made VH1's, what was it called? VH1's What in the Hell? Because
Really?
we put it up strategically. Those billboards by the Superdome,
Yeah.
the ones like if you're going on the West Bank, the ones
Mhm.
right there by that curve. That's where we had that prevention mobsters. And at time we strategically put it there during Essence Fest. So you had the media. It's like, who are these people? Is this guy a pastor and he's talking about condoms? So, and we was like, perfect, 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 because that made people talk.
Yeah, you
And
guys were in Jet Magazine, I think, one year,
we
right?
were
Too.
we were
Essence.
Essence,
Essence, I knew
yeah.
it was one of the magazines.
In
So
2006, yeah, 2006, yeah. So that's the quick story behind that, and it stuck with us. I might have
That's
to
wow.
sing
That's awesome.
the
That's awesome.
yeah.
I'm gonna send a fly. I gotta find it. That
All
was
right.
our
So
most popular bill.
that's awesome.
Yeah, that's all. Well, Tamasha's doing awesome work. Tamasha and Gina are doing awesome work in the community. And as I said earlier, they are longtime pioneers in this industry of fighting and advocating for HIV and AIDS, getting people tested. So this is HIV and AIDS Awareness Month. I'm going to
Okay.
be sending out a flyer to all my Greek friends in honor of the mobsters.
And the Walmart cards.
So make sure y'all get tested. I'm gonna send out this Black Greeks for HIV Awareness Week with HIV prevention masters is January 27th. It started to the 31st. And all she's asking is that you guys wear a red ribbon and repost this flyer, tell people about getting tested and just getting our community involved and aware in this fight that we're fighting with HIV and AIDS. Don't forget that it still exists and our community is gravely affected about it, especially our people that are low income neighborhoods, and it's just not low income, but it does exist more. Of course, we have the worst healthcare and the worst education about and awareness about any disease that exists out here in the streets. COVID has become a name brand item here, but HIV is still here. Don't forget it.
Mm-hmm.
So send me the flyer so I can post it as well, Keisha.
Oh, you gonna get it,
baby. Yeah. And tag us into it. We're trying to get the Black Greeks to use their platform to spread the word. Just something simple. When you post it, just tag us into it. AKAs represent sigmas, poodles, deltas, Q dogs, iotas,
Theta Phi Beta, baby. Don't forget about them.
I was coming. All right,
you was taking kind of long. You was going down a list, baby. I know your Z's, but don't forget about them Zetas.
The Zetas, like, so. But if I forget the Zetas, I'm gonna lose some friends. But
oh yeah,
I'm gonna lose some friends if I forget the Zetas. Yeah, and just tag us into it. We do it. We've recognized Black Greeks Awareness Week or month. At least this is our third year doing it. Because HIV has a lot of awareness events. And like I said, we were like the Black Greeks have this big platform that can be used. And like if you give your cute dogs cappers, you give them that flyer, it'll give them a hint to say, man, let's get tested versus relying on their Zetas and Deltas to be straight, and the AKAs. Because that's a big thing with the men who date women, man. If my girl's straight, I'm straight.
That's not the case.
It's not the case. That is not the case.
Not the case.
So, but we want all people. We want all people that may see themselves vulnerable to HIV, to come get tested. So you can know your status. That's
even if you don't think you're vulnerable. Yeah, because everybody's vulnerable. We're all
look, that's why I want everybody to come, Gina. Everybody come on.
I'm coming to get my Walmart card.
I'll come and test with you. I'll come work with you.
I'm coming to get my Walmart card.
Trust me, I'll be in all the pastors' ears talking about you coming to get tested. It don't matter. Some do and some don't. We got pictures on our Instagram page. You'll see the politicians got tested. We're not playing.
Oh, baby.
Your title don't prevent.
Y'all can test me all day. I'm good.
Your title don't prevent. Titles don't prevent. That's on you.
Y'all get a Walmart card if you go get tested. I'm just saying. I'm putting it out there.
Yes, yeah. Walmart
or so something. You get a gift card, but right now it's Walmart.
With us. Now they got some other providers that do testing.
Only the people that's on this panel up here in the time. So I don't know who else wherever else y'all may go, but the people that's up here in this panel over here with the mobsters, y'all get a gift card. Right now it's Walmart's. I don't know once the Walmart cards run out what kind of card it's going to be, but I'm just letting y'all know it's Walmart. Go get your card.
You get your status card. That's what you get. You get the card. That's the card you're going to get.
And if you don't want to get tested, you can say you go and get your card. The only way you're going to get that card is if you get tested. I'm just telling you.
And here's one thing important about getting tested. If you can bring the partners that you're with, the partner or partners that you're with, whether it be a sexual partner or a using partner, bring them. Like
Don't
bring
pay
them.
attention to her. Don't pay attention to her, y'all. Don't
I
pay attention.
look, trust me. The
The
ones that be
partners,
laughing, they
come on now. That's been a little.
what
Well,
bring your partner.
bring your
No,
partners
You
what they
said
put
in,
in the comment.
partners.
Oh,
and then
trust me, trust me. We've
And
had like
before we go,
a person bring one partner one day and then they bring them the other one the next day.
you
Whatever works. Whatever
whatever
I
works.
mean,
works.
you
All
gotta do
right.
what you gotta do. Hell, put both of them
We
on your
look,
side, sis.
we count them as referrals. Look, if you bring all your partners, we give you a gift card. We give you an extra gift card. You bring more partners. That's how we gotta work the
Girl,
crowd.
by the time you finish, you're gonna be able to get you a whole outfit. Come on, y'all.
and
I'm
because there
Yes,
referring
may be
everybody on
people,
this Facebook and this YouTube. Let them know that Master Coach sent y'all so they can know who to write my gift card to. Master Coach,
There you
please
go.
let them know that Master Coach sent y'all. I'm telling y'all now.
before we go, I
you
want to
need-
make sure that we also let people who may be in a drug injecting community know that we have in the city of New Orleans, we do have syringe exchange places where you can get clean needles and you can get Narcan. So even as far, that's another thing for prevention, because we
Yeah.
know that HIV is also spread through sharing needles.
right.
So if you can get a clean needle, and clean works, you're keeping yourself even safer. So it's
Yeah.
about harm reduction. You know, I'm not telling anybody to start shooting no dope. That's not what I'm saying.
That's not what
What I'm
that
saying
is.
is that if you know somebody and that's their life or that's your life, please go and get clean needles. Crescent Care is one of the places, and
Women's
Tristeria is another
division.
place that you
Yeah.
can get clean needles and Narcan.
And I
Women's
know some of my
division is
viewers
on
are not
really
from
close for him.
I know some of my viewers are not from New Orleans. They don't live in Louisiana, but whatever is convenient and near you, get tested. Find
Right.
another place
Exactly.
that can exchange your needles. This is Louisiana. This is New Orleans individuals that's up here on this panel. So they're talking about the locals. Okay.
Yeah.
But if you are in another area, and I know some of y'all are in different areas, I can see who's on here for me. But please go into that particular local neighborhood of your choice and do your due diligence to get yourself tested.
So to help you out as well, there's a lot of sites throughout the state in immediate areas like New Orleans, Jefferson Parish, and Chalmette that have condoms. You know, your barbershop, beauty salons, the free condoms in their fish bowls or containers. That's free to the public. So if you stick your head in a barbershop, for instance, even if you don't get your hair cut there, you can ask them, do y'all have free condoms that I can grab right quick? They if they have them, you have access to them. Also, like you mentioned, people may not be from New Orleans or immediate New Orleans areas. The best thing to do is Google. Where can I get free condoms in New Orleans? And there's a new site that just came up that lists all of the sites. And also, you can Google where can I get free HIV testing, uh, as well as Narcan. They also have fentanyl test strips. They also have medicine bags. They have syringes like Women's Division Crescent Care. Like Gina mentioned, we have Narcan. We have a lot of Narcan. So a lot of those resources and services are free. So if you Google or if you find us, like somebody can ask us and we's like, we in Gentilly, and they're like, oh, we're across the river. We'll say, okay, here's the location across the river to go. You know, it don't make sense for you to come all the way over to us if you're not coming over here anytime soon. Here's another spot on your side to go to.
So
Yeah,
I mean,
so
y'all can figure it out for my Georgia people, my Kansas people, my North Carolina people, my y'all know
Yeah.
where y'all
Oh,
are.
Georgia.
yeah,
Yeah, we collaborate with
especially
Georgia.
in
So yeah,
Georgia.
Georgia got it too.
I know y'all here.
Georgia got it.
Yeah.
They got it.
My
So
Maryland
They got it.
people, all y'all, New York people, all y'all people.
Yeah, you
yeah,
can
so
always contact your state health department and they'll tell you exactly where to go in your city and your state.
yes, anywhere you are. So that's
Hey,
our time, y'all. So it's about 10 after 8. So join us next Wednesday. We'll have a new topic for you guys. And you can catch me on YouTube at KRead2B and KPRLLC Productions or KPR Productions LLC.
We have to put a banner at the bottom, so when that time comes, you just let them copy it.
Yeah, or yeah, I'm gonna have to put that at the bottom. Because by the time I finish sipping on the wine, then I'm forgetting who I am up here. But I think this was great information that was shared tonight.
It really was. I appreciate you guys.
If you guys have any questions, if you have any questions, of course I'm gonna post the flyer, the information on Facebook, and you guys can get the information if you have any further questions. And remember, you can always go to your local health department within your state or city or wherever you are, and you can Google here is LDH and it will tell you everywhere you can get tested, where you can get free condoms, Norcaine, fentanyl strips, and all that good stuff. So you got so with that being said, stay healthy, take care of yourselves, and I'll see you guys next Wednesday with some more great topics.
It's boss up time, y'all.